Hey, class of 2022. I'm Taylor Yancey, and I'm an OMS 2, and I'll be your lead tutor for RESP-I this year. So it's a super quick course, 3 weeks, just 2 exams, so 100 points. So just gonna try and tell you what to focus on. Dr. Woodbury gives some histo, so you know what to do with that. Histo bowl, really make sure you understand the images and understand the relevance of the images, not just what is on it, but why it's important. Especially with pneumocytes and those kinds of things, really make sure you understand the little particular differences between different things on slides. Then as far as like overall course, for most of the content, they pull it from Dr. West's Respiratory Physiology. I'd highly recommend reading that. They have a copy at the library, and they're just 4 to 5 page chapters, and they have practice questions at the end. So I'd highly recommend that. If you're not much of a reader, even if it's just 4 or 5 pages, Dr. West also has YouTube links. If you type in Dr. West Respiratory Physiology, he has recorded lectures of different lectures you'll see on mechanics of breathing and other things that will align pretty well with the courses, with the lectures that you have in class. And then for the embryology lecture, I always recommend reading at least the clinical correlates section of Langman's. So also those are shorter chapters, but if you're not into reading like whole chapters and you just zone out when you read, at least read the clinical correlates portion, because those could be some higher yield facts that you need to know about the embryo. And then as far as like other ways to succeed in the course, I would just memorize the equations. Anytime they give you any equations, I would memorize them. But I would also understand how you would manipulate variables within the equation. If one variable goes up, how are the other variables related? Are they inversely related? These kinds of things. That'll really help you going into the exam. And then specifically, like the biggest topic that I would recommend like paying attention to, because it doesn't ever go away, is acid-base. So if you pay attention to acid-base during respiratory, you won't regret it, because you're going to see a lot of acid-base in renal, which is right after this course. So it doesn't go away even this semester. And second year, you see a lot of acid-base second year too. So, and then it's your first exposure to Dr. Kinder. He's great. You have him for a lot of second year stuff. He's going to give you clinical aspects of like pulmonary function tests. Really try to focus on if you were in a clinical setting, what would be important to you and how you would evaluate the patient moving forward with each specific type of test and those kinds of things. So good luck. Hope you guys do great.